are coming to you from the Swakopmund District Hospital, where a fair number of residents are flocking to get the COVID-19 vaccine as they join the global fight against coronavirus. Now, this morning we are meeting with Dr. Mouton, who will be explaining the vaccination process of what residents can expect when they come at the vaccination point at the Swakopmund District Hospital.
So normally what we do in the morning, the people are sitting here at the waiting area where we give them health education regarding the vaccine, what they can expect. And there's also a form. So the reason for filling this form is to see if they are eligible for the vaccine. So one part of these forms is, the consent form that they have to fill. They have to give us permission that I come out of my free will to get the vaccine. We also check for patients if they have maybe any signs and symptoms, like signs of COVID. They have like a coughing or fever. And if you maybe have any signs and symptoms, then you are not allowed to proceed in the line. And then also what we are asking is, was he positive recently maybe for COVID? Then you have to wait at least, after you are isolated, after the 10 days, you have to wait for 2 more weeks or for 14 days before you qualify to get your vaccine. And then if they finish with the form, I think he's finished with the form, then you can come through, then he's going to the next station. So at the second stage, what we are doing, our staff, they go through the form, they just make sure that our patients have completed the form. If they understand the whole procedure about the side effects that they can experience, and then if she see that the forms is complete, then he is now, ready to go to our next station. So this is our third station. Yeah, we normally check the blood pressure and also the temperature of the patients. We see if the blood pressure is fine. Also the temperature, if it is not, elevated. So once the temperature is maybe elevated also, then the patient is not qualified to get the vaccine. Or if the blood pressure is maybe slightly elevated, some people are a little bit anxious, then we let them to sit a little bit and wait, and then we recheck the blood pressure. Once we are sure that the blood pressure is fine, and then we can start with the vaccination. So from that table, we normally direct them to our vaccination point where they are receiving the vaccine.
Okay, then I'll explain to the patient the side effects of the medication and then the follow-up date of the vaccine that he's supposed to come back for the second dose. Right? Okay. So common side effects that we have for the vaccine is headache, muscle pains, abdominal cramps sometimes, and then the pain on the site of injection, and then also the swelling on the arm. Right? Okay. If you do have something for pain, you can take it, but if it's really intense and you cannot assist yourself, then you come back to us at the vaccination site. We will fill in the form that is an adverse reaction form, and then we will treat you for the side effects that you have. It doesn't necessarily mean that you will have the side effects. You might have the side effects.
After we give our patients the vaccine, so this is our post-vaccination area where they have to sit for 30 minutes. During these 30 minutes, we just see if they have, any side effects. If a patient experiences, like for example, allergic reaction, because any medicine, you can develop an allergic reaction. So we have our oxygen here. We have some medicine that we can give the patient if the patient has the allergic reaction. So if they complete with the 30 minutes after the vaccine, then they normally move again there to our, our table for the vital signs. It's the final stage for the patient. Here we just check the blood pressure. If his blood pressure is fine, we also check the temperature. If the temperature is fine, and then sister will give him his card once he see that everything is fine. What we also ask our community is to keep this card safe. You know, if you maybe lost the card, then it will be difficult for us to trace where did you receive the vaccine, when did you receive the vaccine. So you must keep it as if it is your ID, always in a safe place. And if you come for your follow-up, then you can just show the nurses at your vaccination site that you have received your first dose of the vaccine. We want Namibia to, to return back to normal. We want our kids to go to school. We want our people to continue working. So if we stand together and we come as a community and decide to get vaccinated, then we can move faster to a normal Namibia again.